I want to go back to the June 16th answers that you provided, or the department provided, and just want to go back over them because I think we got a bunch of non-answers to those. Did LARA have input into our governor's long-term care executive orders? These questions were June 16th. There was a non-answer provided. So I would like to know, yes or no, did LARA have input into our governor's long-term care executive orders?
I will probably need to defer. I can speak for the Bureau, so I will need to probably defer to Marlon or Kim.
Okay, so did you have input as the director into, did you advise your supervisor, your view on the governor's plan?
Representative, what I do is I
Did you or did you not? I don't, you know, I want a yes or no. Either you did or you didn't. We're not playing horseshoes and it's not close. Which one is it?
Sir, I'm trying to be respectful. I guess the question about plan, I'm not sure what you're referencing by plan. I can tell you that I keep my supervisors informed of what we see inside our inspections, and we share that information with our supervisor. So that information can be shared with the executive branch as well as other state agencies. We routinely communicate with other departments like the Department of Health and Human Services.
We're going off the rails. I asked you a very specific question. I asked you, did you look in the plan regarding the June 16th answers? Did you look at the plan and comment whether you were in support or not in support of the plan that existed at the time?
Sir, I'm not familiar with what you're referencing as the plan.
So as the director, you don't know what the nursing home plan was on June 16th as the person who's enforcing this in nursing homes?
My responsibilities, Representative, is to enforce the regulatory requirements set forth in the Public Health Code and in the federal regulations. So I can speak specifically to those regulations. I'm still unfamiliar.
So you did not offer any feedback on whether this was a good plan or not?
Respectfully, I apologize.
It's okay. If you didn't, you didn't. But let's not dance around. If it's you didn't, you didn't. Going to the July 15th. So the July 15th date, Director Harvarth, I've moved on. July 15th. LARA was asked, what science, data, or research did our staff look at to determine the department's position on this plan? And you said LARA does not determine policies regarding nurse source, though did not review any science, data, or research to make such decisions. I will say, did you look at any science, data, or research on the nursing home plan that existed in July?
I can't answer that question.
You don't know if
I'm sorry. I'm just.
Were you with yourself in July 15th? I mean, you looked at it or you didn't look at it. I will say I was a firefighter and a paramedic, and I kept my skills up, and I reviewed the data of the day, and I'm concerned that the director, who does licensing for nursing homes, cannot answer whether they looked, even out of professional curiosity, whether you were looking at the science and the data and the research at the time. Because I get the sense, did you look at the science, data, and the research for this plan?
Sir, respectfully, my role is to enforce the regulations.
I thought your plan was to protect the vulnerable of the state of Michigan.
The Code of Federal Regulations, as well as any orders that are out there. So our role is to enforce those regulations. We collect information, we look at information,
Okay, so just say that you didn't look at any science, data, or research.
Sir, most of our regulations are based upon laws either passed by the legislature or they're regulations passed by the federal government. We do not develop or enact those things. It is our job to enforce the regulations that have been passed by the legislature or the federal government under our state agency authority for CMS.
Director Hovarth, so you did
Bureau
not
itself
consider,
does not create those things.
I understand, but that doesn't mean that you stop thinking. You're a higher level director. It doesn't mean you go, well, this is what they told me. Are you just going to go along to get along? I mean, it concerns me the director who's supposed to be protecting our vulnerable is, this is a new virus. I mean, in March, I understand that we tried some things. I don't fault the governor for March. We didn't know. I mean, really, we didn't know. We were trying to figure out what the best thing to do was. But as time went on, we started getting more data, and it concerns me that the people that were in the field who were seeing firsthand these issues were not communicating what was happening or even thinking about the science and the data and saying, maybe what we're doing doesn't make sense. I mean, I was a paramedic for 27 years. In fact, I'm still a paramedic. And when these plans were coming up, I had some serious questions, like having been into nursing homes myself, getting patients saying, I think a lot of these nursing homes are not up to doing this. So I guess it concerns me when the director is not thinking, you're kind of saying, well, you're not thinking about it. You should be thinking about it. You're a higher level director, and if you have if you're not thinking about it, it concerns me. If you agreed with it, agree with it. That's fine. Be a professional. You looked at the data and said, I agree with the plan. But it appears to me that you can't even tell me whether you even looked at it, which is further scary. Either you did or you didn't look at it as the director who is supposed to be on the wall defending our elderly.
Sir, I can tell you, I look at data routinely. I share information that we see in the field routinely. I read the literature. I work with the Center for Disease Control and the Department of Health and Human Services that have doctors and epidemiologists and PhDs developing these policies and procedures. We provide our feedback. I don't want to be evasive, but I'm just not clear on what plan you're asking me did I look at.
Well, it's scary to me if you don't know what the plan was in June. If you're saying, I don't know what plan it was, I suggest you getting a Gonward subscription because the media talked about what plan, and you don't seem to know what plan was going on then. It is absolutely disappointing. And I will tell you that I hope that, should the state get sued, LARA has better answers for those families. Then we didn't look at the data, we didn't have an opinion, we didn't think about it, we just went along to get along, because I truly think LARA owes these families an apology for not being on the ball on these, and not taking this, looking at the, if we're gonna say we're looking at the data, is absolutely offensive that the people who are supposed to be looking at the data apparently said, I'm just following the rules, and not actually saying whether this makes sense. And sending this up the chain and saying this either makes sense or it doesn't make sense. We got 80 inspectors out there that, and you were asked previously whether the inspectors were asked what they thought, and the answer was no. The people that were out in the field, if this is a new virus, you need to ask people what's going on. Maybe we would have changed the plan sooner if feedback was coming up and somebody told, actually stood up to power and say, I don't agree with this. Instead of just going along to get along. So we are at 10, I'm sorry, we have to close the meeting.